Hello, I'm Chuck Tabor, Provost and Executive Vice President at Kansas State University, and it's my pleasure to welcome you to our second Community Action Talk. Today's talk is going to be focused on COVID-19, the pandemic, and community responses to the pandemic. We have a distinguished panel that I will introduce in just a moment. But I want to introduce the topic and talk through just a little bit about, in very broad strokes, what we'll be talking about today. We're going to do this community action talk in two parts because there is so much to talk about, and because it naturally breaks into a discussion of the community actions, and that's what today will be focused on, and then a discussion of the university strategies, which will be next week. Um, as I think you all know, the COVID-19 pandemic has presented all of us with an unprecedented situation. It's a public health crisis unlike anything our country has seen in over 100 years. It's a diversity issue hitting different communities across our country in different ways. It's become a political issue, and I know as a political scientist, I'm particularly interested and concerned with the ways in which politics interact with public health and diversity. It's also an economic issue. As I'm sure some of our panelists will discuss, COVID-19 and the ways in which we respond to it will have long-lasting effects on the economies of our region, our state, our nation, and also even the budget of Kansas State University. An effective community response to this pandemic requires a partnership among the city of Manhattan, Riley County, where we're situated, Pottawatomie County next door, Kansas State University, Fort Riley. All of these entities need to work together in order to effectively respond to this multifaceted crisis that we're facing. And so we've put together a panel today that has leaders from a number of these communities. And I want to start by introducing Dr. Yusha Reddy, who was the mayor of the city of Manhattan. Yusha is on the panel, and she'll be talking with us specifically about actions and steps that the city can take in partnership with others. We have Bob Koppel here, who's the president of Ascension Via Christi Hospital in Manhattan. We have Jason Smith, the president and CEO of the Manhattan Chamber of Commerce. We have Dr. Ellen Mulcahy, who is the director of the Master of Public Health program at Kansas State University. And so Dr. Mulcahy brings to us some expertise in public health responses. We have Dr. William Hsu, a professor in the computer science department at K-State, who has a lot of expertise in modeling and in the way in which science interacts with policy. So I'm very excited about what these panelists can bring to this conversation. The way that we will conduct this community action talk is I'll start things off by asking the panelists several questions to get the conversation going. After I've asked spent a little bit of time talking through some of the broader issues with the panel, we're going to open it up to questions, and I will moderate that open discussion with your questions, and hopefully we can get a lot of your questions answered today. I'm going to start off with a question for Bob. And I wanted to preface this question by thanking you, Bob, and the entire healthcare community of Manhattan, and really the healthcare workers across our country who've spent countless hours, who have worked closely with patients, have worked closely with people who have contracted the virus, and have been really the front line of our public health response. And so I want to thank you, your team, public health workers, for that. As director, at the hospital, okay, what are some of the steps and some of the training that your staff has been receiving to keep themselves safe and to keep others safe?
Well, our training has actually started before the pandemic and has certainly continued since then. From a bigger picture, we and all hospitals actually do emergency management training. We're required to. It's part of one of the things that we just do every year. So we've always done that. I have to say that I don't know that I've ever been in a drill for a pandemic. The training tends to be, in our business, a lot more focused on perhaps an inrush of patients or something that's a little more time limited. And so this actual experience, we're now 4+ months into it, that in itself is just different. Specific to COVID-19, we actually have put a lot of resources, time, and energy into not only training, but retraining specifically around all the safety precautions. And I should probably explain the retraining comment. And the amount of knowledge that we have learned over the last 4 months has actually been great. That's been a very positive thing, especially in our organization. We have a national presence. We're able to filter a lot of information down to all of our entities very effectively, but we've actually had to retrain because the rules have changed. So if you go back to early April, late March, we actually retrained staff on certain policies, procedures, use of certain pieces of protective equipment. And I remember specifically some days in April, we were training our day shift one way and we were flipping and having to make adjustments to that by night shift and then retraining day shift the next day. And so because as you learn, you certainly want to move with that. The medication use, there's a lot of, in our community, just so people know, we've actually had patients who've received remdesivir. You hear about that in the media. We've had patients here we are part of the Mayo Clinic convalescent plasma study. Some of our physicians here in the community are a piece of that. And so we've also been doing training and learning, and this is our medical staff and our staff, and just really trying to adjust to all the information that's coming out and making sure that we're ready to take care of people.
Thanks, Bob. I want to turn now to Ellen and ask a public health question. So Ellen, you serve as director of the Master of Public Health program, as I said earlier. What do you see as our biggest challenges facing our region as we move into the fall?
Thanks, Chuck. Yeah, I think one of the biggest challenges from the public health perspective is there's two parts of this. There's continuing to be persevering and vigilant and really working on everyone in the community practicing the guidelines that public health has laid out for us. So continuing to work through that and do that every day out in the community when we go about our daily jobs, et cetera. But then on the other side, there's a lot of anxiety and tiredness and fatigue because we're looking at the numbers rolling out every day. We're all trying to keep up with what's happening in Riley County and Kansas and nationally. So a lot of people, find it hard to keep up with all of the new information that's coming out. And at the same time, try to keep up with wearing our masks, washing our hands, keeping up the social distancing. So public health really strives to protect us, the community, at that population level. So when we talk about these public health guidelines that we're following and that everyone can do in their daily lives, we're doing that to protect all of us. Of course, it protects me, it protects my children, my family, but it also protects everyone outside my home, my neighborhoods, my coworkers, people I come in contact with when I go outside. So it's two sides of the same coin. We need to stick to the guidelines, keep doing what we're doing, and then also bringing in new guidelines as they come out, because public health science just doesn't stand still. All science is dynamic and it moves. So when we get new information, we then have to bring those new pieces of data online, which makes those guidelines better. So for every day, we need to pay attention to both what's new, but also keep going with what we know works. So I think that's going to be a big challenge for everybody moving into the fall, because we are going to see changes that we may or may not anticipate. And then it'll be up to all of us as a community to try to figure out how we're going to move forward together. Because obviously, ultimately, our goal is to keep all of us safe and healthy.
Yeah, it is such a dynamic environment. So some of those comments, Ellen, raise sort of a political issue as well. And I'm curious, from a public health perspective, how would you raise concerns that mask regulations infringe upon constitutional rights? And so how do we balance these rights and with the responsibilities that you were just talking about for protecting our community?
Right, that's a good question. So obviously wearing a mask is an individual step that I can take as an individual. And I can, of course, ensure that those people that I'm responsible for, and my children, for example, wear a mask when we're out in public. And then I can encourage my neighbors, my family members to do the same. But ultimately, it is an individual step that confers protection for our community. Now, if you live in a city or a county or a state or a region that has a mask ordinance in place, then you follow those guidelines. If you don't live in a region where there's no mask ordinance in place, then it truly is an individual responsibility that then confers our community protection. And we can draw some parallels with public health measures that we know work. For example, wearing a seatbelt. That's an individual choice that everybody makes when they get into the car. Yes, there are laws and legal processes in place, but we know from years of data that wearing a seatbelt helps decrease fatalities in car crashes. So that's one example. And there are other examples, for example, no smoking in indoor areas. So that is a step that an individual can take. There's a law or an ordinance in place to protect the community, but there's still individual steps. So we need to really come together and see that these individual steps protect all of us. And ultimately, we're interested in that health. Most people are going to take a step that they know protects their families, their parents, their elderly neighbors, because they know that it's protecting all of us together. So public health measures, going back to that population community health, population health is really important because it protects all of us. Now, masks, as you said, they've become a political issue. We're talking about who's wearing masks, why should they wear masks? Not everybody is able to wear masks. But again, we have, a lot of scientific information coming out, and we really have a lot in the last few months about the benefits of masks if everyone, or at least if most of us are wearing them. And, going back to my point about some of this data can be confusing, there's a lot of data out there about, how a mask protects, what percentage does it protect? How much transmission does it decrease? And it's confusing, and it can be, muddling if we're trying to navigate all of those new reports. But I think we still need to go back to, what are our public health guidelines nationally, statewide, locally. We have a lot of really great public health scientists working to look at those new data sets, bring those new guidelines to the forefront. And then these guidelines are to protect us as a community. So it has become a political discussion. And I don't think we should hide behind that. I also don't think that we should play a blame shame game, because we know that doesn't work. Just because you shame someone or blame someone, that usually has the opposite effect. And in public health, we have learned that with other examples. For example, HIVs is a big example where blaming and shaming did not necessarily decrease HIV transmission. So we need to really look at how we as a community can show both understanding and empathy, and continue to reinforce and provide the data that masks are protective, and that if we can get to a point where most of us are wearing them, then we should see some good results. So it's a difficult question. Yes, it's political, and yes, it's confusing, and it can be difficult for people to talk about, but we need to talk about it. We can't shy away from it just because it's a difficult topic.
Thank you, Ellen. Mayor Reddy, you formed the Manhattan Area Recovery Task Force, which consisted of representatives from Riley County, Pottawatomie County, and Geary County. Based upon the input that was received from the task force, there's been a new effort launched called MHK Safe and Open, as well as an educational campaign designed to encourage individuals and businesses to take responsible action to keep our communities safe. Can you share some more information about those efforts? You're muted, Yusha.
There we go. Can you hear me now?
Yes.
Okay. Yeah, thank you for having me on this afternoon. I just want to clarify one thing. I'm not doctor. I wish I was. I do have 3 degrees, but one of them is not a doctorate. So I am a public official, mayor for the city of Manhattan. And regarding the recovery task force, we felt a need to put one together. Back in May, there was information that, you know, Manhattan was going to peak, or Kansas was going to peak in May, and then we're going to have all of these phases into recovery. And the governor had put out her phased recovery steps into place. But I felt we needed to do it in a consolidated, collaborative manner. So we're not all just doing our own thing. And our local health officers from the 3 counties usually speak together and try to come up with orders, emergency orders for our communities. But as our businesses were so dramatically impacted by what was happening with COVID and had to shut down, we wanted to make sure there was a safe reopening. And part of that safe reopening is building public confidence. Even if you have everything open, if people don't feel like they can go out and it's safe to go to a restaurant or to shop in a certain business, we wanted to give a path forward to our businesses to also work together. So the task force is comprised of about 24 people. We have chambers from Pottawatomie County, from Wamego, from Junction City, as well as Manhattan. And Bob Koppel and Jason Smith are the chairs for it. So that represents our business sector as well as our health sector as they make decisions. One of the things that came out of that was the MHK Safe and Open. So this is where businesses can take a pledge, or even individuals and other organizations can take a pledge that they're following certain standards, such as hand sanitizers, wearing face masks, how are their employees managing the 6 feet of distancing. And so if you take this pledge and you have some kind of a form that you can stick in front of your business window, as people walk by or as they go onto your website, they'll know you're taking certain precautions. They'll know you're taking certain measures to keep your community or your business safe. So hopefully people will want to enter your business, spend money, and enjoy what they're doing outside, and make sure we're having a lot more businesses take that pledge, as well as nonprofits and individuals. So that was one of the things we are still working on. The task force is working on it, and we have city staff working on that as well. The other piece to that is not just the pledge, but to make sure that now that we have the face mask ordinance in place, that people understand that certain metrics are being followed and people are following the face mask ordinance as well. It was just pointed out that we all need to be a part of this together, and to make sure we are having the same discussion instead of the business sector working against the health sector or vice versa. I think if we have good public health policies, we will have good business sector and we will be prosperous in the end. If we don't take those measures and people don't go out, are reluctant to go out because they feel businesses also are not stepping up and doing what they need to, our businesses might end up shutting down again. And that's what we're trying to avoid during this process. I think the conversations have gone well. They just had their 10th meeting, and the city is also going to put out a public information campaign regarding what does it mean to wear a face mask. There's a right way to wear it, when you don't have to wear it. What does 6 feet of distancing mean? What does it mean to have gatherings of 50 people or less? Just so people are informed. We know there's a lot of questions out there, but we want to make sure, as we anticipate K-State students coming back to campus and K-12 is going to open up, that the message is the same, that people have the answers and the message is consistent across the board. And that's one of the key pieces to this, that we're all talking the same vocabulary and the same language as we move forward.
Yes, as I said at the outset, this partnership is central to our success. I do want to point out also that at K-State, we've created a social norming and education campaign for our students, faculty, staff called Every Wildcat a Wellcat.
Mm-hmm.
We'll talk more about that next week if you tune in for the next effort, but the next CAT talk. But I do want to put that in there because it really parallels what you just described, Yusha. So just to follow up, what steps could be taken in the Manhattan community to enforce or at least increase compliance with wearing masks, maintaining social distance, other strategies designed to flatten the curve?
Sure. Flattening the curve is the key piece here. I think there was this we haven't peaked yet. And I think we need to understand what the numbers are saying. We have I think about 418 cases now, although 113 are active and the rest have recovered. Back in June 24th, we had 83 active cases. So we are still progressing. We are still having about 78 cases, positive cases a day. And Bob can speak to what he's seeing at the hospital. So we still need to be actively engaged and persuade people to wear the face masks. We don't have a vaccination, we don't have medicines, we don't have any of those ready for us to take advantage of. But what we do have are some of these best practices. And if all of us adhere to them, we can actually reduce the spread and flatten that curve or slow it down. We're not going to get rid of the virus, but we can certainly slow down the spread of it. And that's what we need to have buy-in for. And that's what the campaign is hoping that we will have, that buy-in from the community. You addressed a political component to this. So it's not just face masks being political, it's the entire term of pandemic being political. So there are lots of populations that haven't bought into the pandemic itself. And when you're even questioning if it's a pandemic, we have a bigger problem. So these are education matters that we have to continuously message out there. But I think, as K-12 decides to open up here, they're also going to be looking at best practices such as face masks, just as the university and Fort Riley and our city has. That is one piece that we can do. It's a simple measure, and that's what we want to put out there, that it is okay to wear a face mask. It is not a political issue. All of us are going to know somebody who's had COVID-19 during the next few months, if we don't already know somebody who has it. But this is something we can do. Like I said, it's simple, it's accessible, and that message needs to be constant and consistent, just like seatbelts. Not many people were wearing seatbelts, but the message was so strong. Now everybody's wearing them. Even for drinking, now everybody, if you drink too much, we're used to saying, do you have a designated driver? That wasn't the case in the past. So this has to be a lot of public information out there, and consistent and constant, and making sure they know why they are doing it and that it's okay. It's okay to do it, because that's all we have right now to reduce it. Otherwise, the alternative is we're going to have to shut down again. And we will have serious cases in the hospital, and we may have more deaths in our community. This is one measure we can do to slow that down and even prevent it in the long run.
Thank you, Yusha. Jason, the Manhattan Area Recovery Task Force developed an opening with care checklist that businesses can use to communicate what they're doing to keep employees and patrons safe, and to build the consumer confidence that Yusha was just talking about, that's so important to community buy-in. Can you tell us a little more about these efforts?
Sure. First of all, thank you for the opportunity to be on this call with the other distinguished panelists. I feel honored to be here. When the pandemic started in March and businesses were forced to close, obviously it became an extreme challenge to those businesses to understand what the future held and their ability to stay open. And our staff at the Chamber worked, along with a number of other organizations, diligently with those businesses, particularly the ones that are locally owned, because national groups tended to have more resources available to them to understand what various options they had, whereas a lot of our local businesses did not. And so we reacted very quickly in partnership with the City Commission and Mayor Reddy, and created a fund that helped nearly 100 businesses who were really in an emergency crisis. And then we worked with all those close to 1,000 businesses in directing them to federal resources that were able to help them work through the process of potential, in a lot of cases, being closed and not being able to sell their products. And so that gave us and them the opportunity to be a little more cautious as they looked at their opportunities going forward to reopen. When the numbers finally come out, I'm sure it'll be in the tens of millions that were poured into Riley County and Pottawatomie County in the form of disaster loans through the SBA or the Payroll Protection Program through the CARES Act. So So then we started getting questions about, okay, how do we do this? How do we how do we reopen? And there wasn't a blanket answer because each business has their own way of interacting with the public. If you look at a manufacturer, they are more concerned with keeping their employees safe because they're not dealing with customers. And so they had a strategy for staying open. If you're in an office environment, how do you, what do you need to do to protect your employees, and move a lot of your interactions with customers online? But then for retailers and restaurants who are having to deal with customers on a regular basis, it would be a different set of criteria as well. And so we worked with, at the time on our team now with the Flint Hills Regional Council, Christy Rodriguez. We worked with city staff and pulled all the resources together from state guidelines, from CDC guidelines, and compiled a document that helped businesses understand the best way to reopen safely. And whether it was masks or cleaning or whatever variety of steps that a business could take, they could look at this document and figure out how that what they needed to do to make that happen. And we tried to narrow it down on each industry on a one-page flyer, so then that business could post that their checklist on the front door. So if somebody came by and looked at the checklist, they would have a clear understanding of what the business practices were in terms of keeping them safe. That part of it is actually morphed into the program that Mayor Reddy talked about, where the business can take a pledge and get a small sticker, and it's a little clearer and you understand, I think, a little better how to display that, and then the citizens can understand that a little clearer. However, we still have all the documentation available for businesses to look at and for them to understand what's going on. I have been very impressed by our business community and their, I think occasionally you get a bad story that gets out, but compared to what I hear from some of my counterparts in other cities, I have been very impressed with how our business community has responded. They all are very concerned about protecting their employees, protecting their customers, and quite frankly, I have been very impressed with the citizens of Manhattan as well. We have not had the horror stories that other cities have had in terms of compliance, and once the mask ordinance went into effect, I assumed I would start getting a lot of complaints. So far, I've gotten zero. And again, that is not the same story that I hear from the chamber presidents in other communities. And so I think that speaks, number one, to Mayor Reddy and the health community and their communication with the public about the importance of masks and protecting yourself and others. But I also think it's the character of our community and understanding that we are in a situation that if students can't come back, if we can't have football season and soldiers can't come to the community, we're going to be in trouble economically. I know the mayor talked about a shutdown, but quite frankly, those three things would be as damaging in some ways as a shutdown would. And so I heard somebody say one day, if you love football, wear a mask, because we're not going to have football season. I think that, and if you love students, if you love soldiers, I think all those things we could say are important to us. So it's been a good program. I would say the second step of that is the program the mayor talked about, which hopefully will even be clearer and better for the citizens to understand the process that our businesses are taking.
Yeah. Just a quick follow-up, Jason. So in terms of specific to some of the local businesses in particular in Aggieville, as they work to comply with local health orders, what are the things that they're able to do? And is there anything else that we all could be doing to be proactive in preparing the Manhattan community for when students return just in the next few weeks?
Yeah, I mean, again, I think that at the end of the day, we have a personal responsibility to be, I don't like the word compliant, but to understand why it's important for us to take these measures. We have people working in these businesses who don't have expertise in enforcement of laws and rules. And yet we are relying on them in many cases. So, think of the restaurant worker or the bar worker. We are relying on them to be the enforcement arm of the community. And that's a very difficult thing. That doesn't mean that it was a bad idea to have the ordinance. It's not. And it doesn't mean that RCPD isn't doing a good job. They are. But when you have so many interactions with employees and customers, and you're counting on those employees to enforce these rules, it gets very challenging. And so I think what we really should do as a community is understand that when you walk into a business and they've asked you to adhere to a certain rule, whether they're either doing it because it's a law that they're having to enforce, or it's a rule that their business is set to protect themselves and their customers, and just try to be as cordial and understand that as much as possible. And I know it's hard, and I know we sometimes we walk in and don't understand why there are rules in place, but they're there for a reason. And at least till we get through this, we should try to be as courteous as we can, and understand those businesses are just doing their best to protect themselves and follow the rules.
Thank you, Jason. Bob, I wanted to circle back to you real quickly and ask you another public health question. One of the things that we've talked a lot about from the beginning is the need for testing and contact tracing capacity. And I wonder if you could just give us an update on what the situation is in Riley County. And then also, how are the Spark CARES Act funding in Riley County being allocated to increase the community's capacity?
So actually, I'll maybe answer that in reverse. So with the Spark funding, that process is kind of in process right as we're speaking. And that will carry the allocation of those funds because it appears the funds will come out kind of in 3 different groups of funding. So the first funding is now available. It's with the county. They're in their process for that. I think actually a lot of some like information materials coming in today to them, and they'll be working then over the next couple of weeks to actually then kind of, it's been allocated to Riley County. They'll be reallocating or sub-allocating it, if you will, to the school districts, to the other taxing authorities within the county. So the other smaller communities like Ogden and Leonardville and Randolph, Riley, that sort of thing. So they're kind of working through that. And along with that, then they have kind of these lists of priorities of things that they are also trying to fund. And like for schools, for example, making sure that we do have materials and PPE or cleaning materials, things like that, that the schools would need, for example. So it is there's kind of this moving puzzle, if you will, of allocating to different groups, then they're going to be reallocating into specific initiatives or projects. But there's also 2 more rounds of this funding that is coming out. And so that's the piece that I think everybody's, including the statewide Spark group, but then each of the counties, now have got to kind of enter that process too. So specific for testing, I think we're anticipating support for that. That's actually been consistent with the larger population counties. They got their money first. And so like Johnson County, Sedgwick County, they have actually carved out some money to help fund that. And that's really just to, one, support for those who perhaps don't have access to that or a way to get that. But the real challenge with testing, and this kind of goes to one of your other questions, is actually having the devices to run the equipment on, and then all the materials that's required for that lab equipment. And to be real transparent, that last piece is where we are struggling as a country, certainly in our state, is getting the reagents for the laboratory equipment, or there's actual little test kits that are specific for each sample that's going in the test kit. And so you end up needing, in our country, we're now doing tens of thousands of these a day. And so it's just getting a supply chain or availability of those materials out. Kansas is a low population state compared to other areas that have a lot of COVID activity. Relatively speaking, we still have a somewhat lower incident rate of positive COVID tests. And that is definitely changing. I think, I don't remember if that was Lucia or somebody else had made a comment, if you look back to June 24th to now, we're actually multiples of positive since then. So our activity is still kind of ramping up. But because we're a low population state and our incident rate, our state is actually not allocated as much of these materials for testing, some of the medications, because it's all being population or incident rate based, which makes sense. I mean, I'm not challenging that thought process, but it just has been a little more difficult for us to get materials. So locally, where that leaves us with testing, so we have a couple options like right here in our region and our communities. At the hospital, we are able to do testing at this point for our inpatient, for inpatients, and that actually has been the limit. And the reason for that is the supply chain piece. That actually today is a good day for us. We've gotten additional testing materials. So that's going to allow us to start the expansion of that capacity. Back to the Spark money, we're going to be requesting from the county money to not only increase the capacity of the lab equipment, you can actually get modules that add on to allow you to do more at a time, but also we're starting to get availability of the materials that we need to actually run the more tests at a time. The BRI, the Biosecurity Research, in working with the K-State Vet School, their laboratory has been doing COVID testing, I think since mid-May, maybe even early May. I can't remember exactly which week they started. And so they also have a capacity. They're doing tests for a number of different entities, both regionally, and then they have been called upon, I think, at times to help support KDHE and their testing. They are also in a process of trying to ramp up their capacity so that they would have the availability of more testing. They have the same challenges all of us do. You've got to have materials. They may have the instrument, that's great, but now you need the materials. I think the other challenge with testing that's become very evident is kind of swinging now back to the front end, and that's the actual interaction with a patient to get the swab and take the sample. It's just a physical issue of how many people can you run through that kind of process, because there's paperwork attached to everything. And you want the results obviously to be tied back to the right person. That's why we're very diligent about that. But it's the matching up and keeping having the capacity to do all those swabs. So in town, we've been really lucky. There's a task force of a bunch of our community physicians. They've been working for the last 4 months, actually going on 5 months now. We work with the hospitals in town, all the clinics in town, our health department for the county, and then our FQHC, our locally federally qualified health center, which is Kansa. They have actually been a key part of this. They very early on had access to federal resources, and they're the ones who are able to facilitate getting our swab and respiratory tent set up for the entire county. And that's really a lot of that has been on the backs of Kansa and of the private physicians in town, because we have a lot of physicians who've been donating their personal time to make sure that this got done and people are getting taken care of. And people may not be aware of the commitment that all of these individuals in our community have actually been making to help everybody out. And then kind of the last thing is, and this kind of gets back to the testing capacity thing, Chuck. So what we have done is take a layered approach. We actually have 5 labs that we now use on a daily basis, depending upon the need and the generation of the swab, to which 5 labs we actually send a swab to. And this is all about trying to keep our turnaround times as tight as we can get, but also to kind of spread the volume a little bit. So we actually send some swabs to the BRI. We do some ourselves. We send some to our lab in Wichita. We send some to our Ascension lab in Tulsa. And then depending on the situation, we'll actually use a 5th location as a way to kind of divvy things out and try to keep everything moving. The swabs, the lab equipment, a lot of this is proprietary. So you can't use the same swab on every piece of lab equipment. So we now carry an inventory of different swabs and test media. And every swab, depending on what kind of swab it is, that will dictate then which lab or which piece of equipment in that lab that it can actually go to. So it is a little, it's become a complex situation, if you will. It's actually working fairly well. And I think our goal now is to ramp up the capacity. We know what's coming is going to be a need to significantly increase the amount of testing that's done. Currently in town, we might be generating probably less than 200 swabs a day. And so we've got to, as we know our community need is going to perhaps become multiples of that. That's the question, is how do you find or create capacity for perhaps 400 swabs a day, 600 swabs a day, 1,000 swabs a day. And that's we're all actually actively working on that.
Thank you, Bob. I know it's really complex. I want to end this portion of the conversation today before we turn to the questions from you with Bill. And Bill, I want to ask you a couple questions around some of the diversity challenges that we're facing here in this COVID crisis. So I want to start with a question about some of the stereotypes that have been used. You know, some politicians and some media figures have taken to referring to COVID-19 as the Chinese coronavirus. They've used stereotypes to poke fun. They've used Chinese-sounding words to make light of the crisis and somehow imply that Chinese people are to blame for this crisis. What are the real world effects of xenophobic and racist comments and statements such as this?
Thank you, Provost Tabor. I think that's an important question for us as a community. It's certainly significant to me as a member of the Manhattan community, as a faculty member at K-State, and as an American of Chinese ancestry. Ignorance and racism are hurtful, of course, not only in the emotional harm that they inflict directly, but in the escalation of racism and violence that they enable. Sometimes the kind of insensitive or offensive statements that you allude to that we hear are really made in ignorance, tasteless jokes, for example. And sometimes they're pretextual, where someone really does harbor ill will or resentment towards some ethnicity. But I don't think there's an ethnicity that's alone in this or that's safe from this, because at different times, you know, this situation, this pandemic really goes to show that we can and do show each other how to treat one another. And today may be directed at Chinese and affect mainly people who appear Asian and Asian organizations and businesses because of where infected humans were first reported. However, we're in a shared crisis with this pandemic, and it's become global. And now, just as in other more normal times, we have to express how hateful and ignorant statements that are made in fear and anger threaten us all, and they fuel deeper and more structural discrimination in the longer term.
Well, thank you, Bill. And so what are some strategies that you think that we could follow to realize a more inclusive community? Broadly speaking, here in Manhattan and Raleigh County, but also at the university, that would address racism and bias and support the members of targeted populations. And you're absolutely right. You know, it's not. It may be one population that's targeted for particular reasons at one time, but another at another time, and it really is driven by this kind of ignorance or sometimes, you know, actual hostility or antipathy. And so, how do we address these concerns?
Well, to start with, your term targeted population is very apt. Discrimination affects and victimizes many groups at different times, be they women or Black people, Indigenous people, and people of color, including Asians, LGBT people, or people who exist in intersections of these populations. One thing that helps us to try to reach meaningful action is understanding that cultural adaptation is a mutual need and it's a shared responsibility. It's important that we come to an understanding that there are differences in our background and in our cultural values as individuals, as families, as communities, including our learning community. There's a lot for all of us to learn about equality, equity, about inclusion and the subtle differences among these, and about our various economic and social needs and challenges and what privilege is. Concretely, I have seen allies in the last few months come to peaceful public demonstrations, such as the several that supporters of Black Lives Matter organized, and there's intersectionality of diversity there, be it how Asian American allies and our students and alumni came out for this, or how we help to keep our allies with disabilities or who are immunocompromised safe, or how we work together as citizens with clinicians, immunologists, and other scientists like our colleagues who are looking at vaccines and drug discovery and other kinds of treatments and public health, as educators, as community leaders, or business leaders. So as citizens, as a citizen of this community, I think that's something that we should look at as a shared responsibility and shared need.
I completely agree, Bill. Thank you. So I want to open this up now to your questions. Those of you who are on the YouTube video, if you could please forward your questions in. With our panel is happy to answer questions, illuminate some of those concerns. While we're waiting for those to come in, I would just want to follow up on Bill's question, the question I asked Bill, but ask it really of all of you. One of the aspects of this pandemic has been that it's had disproportionate impact on certain communities, in particular communities of color have had higher rates of infection, have seen greater impact across the country. Why and what sort of steps can be taken to address that kind of impact? And that could be for any of those on the panel while we're waiting for other questions to come in.
Sure, I'll add some context to that, Chuck. You know, that's definitely true. We have seen a disproportionate impact on communities in this country, particularly disproportionate impacts on the health of Black families, Hispanic and Indigenous families. You know, when we look at hospitalization rates, and I'm sure Bob can answer this specifically for our area, or if we look at fatality, you know, we have seen higher hospitalization rates for Black people in America. We've also seen higher death rates compared to of Black individuals in this country compared to white individuals. And, you know, we can do a state comparison, a national comparison, but we definitely have seen negative impacts on the health of Black Americans particularly, but also Hispanic and Indigenous populations in our country. And I think this points to a deeper, more serious concern in the United States about a lack of access to health, but also a lack of equitable access to health care. And, you know, what I mean by that is everybody should have an equitable or fair or an equal chance to health, whatever measure we take, whether that's increased access to be able to go to a doctor, or increased education about diabetes, or increased access to the same type of K through 12 education. So when we talk about equity in order to have the healthiest life that we can, you know, we see this in our country, and I think we are definitely seeing it now with COVID-19. So I think it's a big concern for all of us moving forward. So definitely the public health community and all communities should be concerned by this.
Thank you. We have a question that's come in that I think is mostly for Bob, but others may weigh in if they wish, have information. How will the Manhattan medical community handle a surge if it happens once students are back?
Well, so one, that's obviously something we've been talking about since February going into March, certainly. I think we have to kind of keep a few things in perspective. So the surges will actually occur in over a time frame, but also they occur in very different areas. So the first piece, and we saw a little of this, it really, when we started getting a lot more positives in June, the impact was actually on the outpatient side. So in all the primary care clinics in town specifically. And that's the corollary with the university would be Lafayette. That's the primary care site for the university. We also saw the same thing happened at the base. So you have, in our case, it tended to be a younger population, but very significant volume. And so they're quite honestly, they're just a limitation that we reach at the primary care side, just because we've only got a certain number of providers in the community. So I think that's the first stretch. That's actually gotten better over the last few weeks. It's kind of, and we anticipate it's going to kind of ebb and flow. That's how this is going to work. So the primary care piece up front is probably, it's also the biggest piece. You know, I think some people forget, you know, everybody always talks about the healthcare in the community, and they look at the hospital, which is great. That's us. The reality is, outside of OB, we have like 3,200 patients a year. That's it. That's our normal year. And in the community, you're going to have somewhere between 400,000 and 500,000 physician office visits. And so that's actually where healthcare happens. I mean, it's, maybe you think the hospital guy saying that is weird, but that's actually where healthcare happens, is in physicians' offices, by and large. So that's also where that's the greatest capacity. And our learning, so far over the last 4 months is that the population, and this kind of across all age cadres, that actually need hospitalized because of COVID is somewhere less than 15%. But that's also why you try to control up front with masking and hand hygiene and social distancing to minimize the population that actually gets sick. So then you're going to take a subset of that, which is typically in our country, and it's a little different in every country, but in our country, that's been less than 15% have need hospitalized. And then there's a subset of that are actually going to have long length of stay, need critical care coverage, like in an ICU. And there's even you get down actually to a very small percentage. There's always a lot of conversation about how many ventilators you have, all this. That actually ends up being a really small percentage of people. And we've also learned over the last 4 months that high flow oxygen may be actually more successful with patients than ventilators anyway. I mean, there's all this other stuff we've been learning. So from a capacity standpoint, you start with a funnel. That big funnel is primary care. You try to manage as many people as you can as an outpatient and keep them at home. For those who come to the hospital, once we get here, we actually have surge plans. Every hospital in our state has this. And so we have plans of how we would add additional bed capacity and space, and we will be converting spaces. This is what we were practicing when we did the shutdowns and we quit doing all the elective procedures and we quit doing a lot of outpatient services in April. That was our time to plan how we're going to reassign our own staff, how we would access outside resources from outside of our state if we needed to. And that's how you then ramp up your capacity. And so you go from, perhaps running a census of 40 every day. What is your plan to get to 60, then to 80, then to 100, then to 120? I mean, can you actually triple your capacity if that's what you got to do? And so that's been the planning. Our county emergency operations center was replicating that same sort of planning so in the community, what do you do to increase capacity with temporary sites, with alternate care sites, with holding facilities, with all these other things to help add capacity to the outpatient piece, but then also to back us up. Because your community hospital ends up being the backstop. Everything else fails, we're it. And so that's why there's all this work on how do you keep people out? And how do you, on our side, how do we keep expanding that backstop capacity? I know that's a long answer, sorry, Chuck.
No, that was a great answer. Thank you, Bob. I'm going to, so Yusha had some comments also, I believe, to address minority populations in COVID. And so I want to circle back to that question, and then we'll continue with some of the other questions coming in.
Thank you, Chuck. Yeah, I just wanted to say there was a previous question about minority populations being impacted more so than other populations. And I just wanted to add, I think, this shows the income disparities also. When we talk about essential workers or essential jobs that need to be kept open, you often see hourly workers and, either single moms, young kids, people that really don't have disposable income. The ones that do have disposable income are the ones that are not going out and spending money, that are actually staying home, can order in or can have other ways of dealing with COVID, but not having to worry about a retirement plan or a stocks or 401k plans. The ones that are feeling impacted are the ones that can't put food on the table. Therefore, they have to go to a job, even if they have COVID-19 and don't want to tell their employer they have it. And those are some of the populations we're seeing. I think the other thing that we're probably going to see when schools start to open, whether it's at higher ed or K-12, is the people that take online, even for K-12, are the ones that probably have resources where they can keep their kids at home and teach them or provide those services at home. The ones that have to go to a job are going to need those school services to be open for academic purposes. And even for higher ed, sometimes online classes may be more expensive than in-person ones. Well, the ones that can afford the online classes are probably going to stay home and do that, as opposed to go out and because they need can't afford online, will go out. So I think there's different, once the pandemic nears an end at some point, it would be good to see those metrics as well. I think the populations that don't have disposable income always may not have the best eating habits, may not have health insurance, may need childcare needs, but now they can't take care of their children because they can't go to school. So I think there's so many factors involved in making them a vulnerable population at the same time. And that's one of the things that's impacting our economy is the ones that have the disposable income are not going out to our restaurants or anywhere else to spend money, going on vacations and such. So I just wanted to add that to the dialogue.
Those were really important points. Thank you. I have a workplace question that's come up. So what guidance would you offer someone whose supervisors don't social distance or wear a mask? And really, I would generalize that question of what guidance would you give to somebody who encounters people who don't wear a mask? This question, particularly it's someone that has power over them because it's their supervisor, but more in general, how do you advise people to react and handle that situation when they're encountering people who are not taking precautions? And this is generally for the panel. I know, Ellen, you probably have some expertise in that, but Yusha, you probably have.
Yeah, I clicked it because I actually experienced this. A friend of mine had communicated with me that her daughter was working at an establishment where they weren't following the mask ordinance. And they told this employee, we don't need to follow it. It's probably going to go away in a couple of months anyway. And it's against the Constitution. And then this employee had actually called in RCPD and told them, hey, they're not following the mask ordinance. I don't think this is right. And I think PD went there and had a conversation with them. But ultimately, she left the job. She felt like it was not safe for her, and she had to just left the job and went on to another job somewhere else. This puts our employees in a very difficult position because they're there because they need the money to pay their bills. But holding people accountable is a factor. We certainly don't want to be punitive and start putting out citations and fines and such. And we're hoping that people more often will understand the reason for the face mask ordinance and hopefully will work through that process. And the education piece is a big part of it. But sometimes the only option employees have is to leave. And otherwise they might see lawsuits coming their way. If you don't take all precautions necessary as a business, there's more repercussions than a citation. You're putting people at risk, and you're putting your employees at risk and your customers at risk. So we have to get past that political piece, and hopefully the public campaign is going to be part of that, the reasons to do this and how we want to keep businesses open. And this is the reason we're doing this. So those are some things we are getting sporadically here and there, and it does put the employees in a very difficult position. But I'm also happy to see a lot more corporations such as Walmart and Menards and Home Depot and all of them going to the way of requiring face masks. So it becomes a corporate issue and not so much as individual businesses and individual employees.
Dr. Tabor, I might add something in that as well. And this was more of a problem, I think, before the mask ordinance, but and we have talked to RCPD a number of times about this, and Director Butler is very adamant that if a business has a rule that if a business has a rule and you're a customer, you have to abide by those rules, or they have the right to refuse your service. And again, it was more of a problem when certain businesses would require masks, and that wasn't a community a rule yet, but that you have to follow. The business has the right to ask you to put on a mask or wear a mask, maybe where the ordinance doesn't require it. They can require you to do that, and if you don't comply, they can ask you to leave. And if you don't leave, they can call the police department. So, and that would be for an employee, or, if an employee feels threatened, they have the opportunity to call RCPD. Certainly if it's a customer. And again, it's going back to the situation that was asked. I mean, it's a law, and I think Mayor Reddy's right. You can call RCPD and ask them to intervene. And hopefully that takes care of it.
Yeah, that's great. I'll just answer for myself a little bit. I'm a social scientist, so I've done a lot of work on persuasion and some of the limitations on persuading other people to do things you want them to do. Just one piece of advice I would give in general is that it's always more effective to be reasonable, to stay reasonable in your conversation with another person, and to appeal to them on a broad level, appeal to them on the level of principles. So I would suggest, and it may sound naive, but in fact, the research suggests it's not naive, that if you appeal to people with things like protecting the community, protecting others, concern for others, that people will often, they may be grudging, but they will often go along with what you're asking them to do, because you're asking them to care for others, and they do. Fundamentally, people care for others. So that would be my piece of advice on that as well. Bob, there are a couple questions here that I think are really, really aimed at you. There's a question here about coordination with Lafine, between Lafine and the hospital, and then a question about how quickly test results are coming back now that we're using multiple labs.
Sure. Well, from a coordination standpoint, we actually, one of the big pieces of that is we have what's called the MHK clinical task force. So it's a number of the 20 plus physicians from in town, CONSAR, FQHC, Lafine, the hospitals, everybody's kind of together on that. Actually, starting in March, very regular meetings, sometimes once, sometimes twice a week, make sure we're kind of in sync on that. Kind of the go forward with Lafine is, we actually work with them all the time, depending on what student needs are. And so, and that might be a transfer to, maybe they might see somebody in clinic who needs to be transferred to the ED, or they need special testing or something like that. That's been forever. Specific to COVID, I think certainly trying to stay connected. Lafine's been using the BRI when they need to do testing, so everything's kind of within the university process, which has been great. I think our challenge going forward, and this is something either with Dr. Girl or others, is how do we leverage to make sure we keep getting materials to do the testing. I know there were some questions about, so how basically what's the turnaround time? What's the availability of getting things done? I think the challenge, I'll be really honest about that, it's different almost every day. 2 weeks ago, things were like working. Kind of didn't matter where you were sending stuff that we were sending out anyway. We were getting less than 48-hour turnaround. Things were good. And then supply chain issues started to pop up. And when you have we use big reference labs like AMS and RML. When they don't get their truck with their shipment of stuff on it for the next few days, that causes a backlog. And so we had that happen about 10 days ago. It happened again this week. And so that starts to push your times out. Some of the national labs are actually still running at 10 and 11 days for turnaround, which if you do have COVID, you're probably almost recovered by then. And that is definitely a process problem. Still within the state of Kansas, if you're using a lab in our state, for the most part, I know we had crept up to some 72, 96-hour timeframes for some of the work that we're doing in state. That has actually come down in the last, literally in the last 36 hours. That's gotten better again. And so, I think that's just it ebbs and it flows. We do, our fifth location where we send tests, we actually send some of our tests to our rural hospital in Wamego because they have another device. It's yet another piece of equipment. And when we're able to get supplies for it, we're actually able to get same day results. And it's just every day is kind of this numbers shifting things around game.
Thank you. There are a couple of questions here that I'm going to ask together, and I think it's mostly would be targeted on Mayor Reddy, and Jason. The first of these is, what specific actions can we take to help our returning students feel that they're part of the community and that we all have a responsibility to each other? And I'll just ask the second that I think is related, although a little broader. It's about food insecurity. We faced food insecurity with students and staff before the crisis, before the pandemic. Are there any additional steps that can be taken in the community when students return to help alleviate food insecurity, which may be more of a problem now given the increased economic impact of COVID-19?
Yeah, thank you. There's so many things we do that people may not know that we do as far as the city of Manhattan. We work very closely with USD 383, with Kansas State University and our community partners, as well as the chamber, to meet the needs of the entire community population. and a large percent of that is K-State students. So we understand that we need to take care of them. This is their home away from home, and we want them to make it a home for them while during their stay here. And we take that job very seriously, whether it's working with the organizations on campus and off campus, with our businesses and such. To make them feel welcome, we're already having lots of conversations with Kansas State University, with Linda Cook in particular, with the Every Wildcat a Wellcat program. You know, we want to be part of that initiative because we don't want the rules to be different when you're on campus and off campus. The rules and the care needs to be very similar, if not just flowing easily, so they don't say, well, we can do this in the city, we couldn't do that on campus. It needs to be very consistent in the message, and that we care about each other. The community care needs to be there. And that's something we are going to be working on together to make sure they do have a good experience and know that they are safe in our community. I know Kansas State University is doing a lot with testing with students on campus. We're going to try to provide the same services off campus. For the food insecurity piece, that is one of the largest pieces. You know, we talked about Spark funds and the CARES Act money. That is taxpayer money. And one of the things we're seeing is there's certain percentages of those funds that are going to meet the food needs in our community. We have lots of churches and nonprofits that are working to make sure people get their meals. We have a lot of seniors that don't live in senior citizen homes, that still live on their own in their homes, trying to meet their needs, as well as students that are going to come here that may not have the enough money for food. So those are some funds that are already coming our way. I think at the federal level, they see that's a need in every community, and we're going to make sure we have the resources and the people and the organizations ready to serve the community as soon as students start to come back. The other piece is folks at the city are easy to, we are approachable and accessible. I don't think people realize how easy it is just to email me or anybody else at the city staff, and you will get a response. This is mainly because you now belong in the city of Manhattan, and we want to make it as wonderful and as peaceful and caring as we can. So if there's a need that's not being met, please feel free to email me or contact the chamber or any of our city staff to help you with that process. But we plan on working with the university hand in hand to make sure that it is a safe transition. And if schools, you know, should have to go back online at some point, we want to make sure we are also addressing those needs as students come and go in our within our community. When students come back, they're going to come back from a variety of places, and we want to make sure that there's a place for them to quarantine if they need to. There's a place for them to be away from their families if they need to be away from their families because they want to be sure their family members don't get it. So these are conversations that are happening 24/7 and have been going on for quite a while now. And it's not going to stop until we make sure we are taking care of the needs of our community members.
Yeah, and I would add on the what can we do to make K-State students feel more at home. We would be interested in hearing back from them. So, you know, we are very interested in this being their time in Manhattan being a good experience. We obviously would like for them to consider staying after they're finished at Kansas State and being part of our community going forward. So, any ideas that might come out of the student population? One of the things we do at the chamber, of course, Linda Cook, who's on the president's cabinet, is on our executive committee. And then every year we put the student government president as an ex officio member of the chamber board of directors. And so we have the constant communication with the city, with the student government. And so any ideas that the student community would have, I think we're open to those suggestions. One other question that popped up that I might address as well is daycare is a significant problem, and we hear that from our employers in terms of potential new employees finding adequate daycare, particularly at off hours. So one of the things and I mentioned earlier, when our partnership with the city on emergency loan funds, we had a high number of daycares who were eligible for that, and we felt it was very important to try to keep those businesses open because they are so critical to our economy going forward. And so Hopefully there will be some money out of Spark that is set aside to help daycares reopen or open, because that's going to be critical. And then the last thing, there was a question on that specifically asked about what I said about RCPD. My source in terms of their ability to help if there are enforcement issues is from Director Butler. And as Mayor Reddy mentioned, there was a situation where somebody called and RCPD came and visited with a business where they weren't enforcing it. So my understanding in talking to Director Butler, both privately and then also some comments he's made, because he's a member of our reopening task force, is that they will enforce the mask ordinance, and they will enforce a business's right to refuse service to anybody who isn't complying with those rules. And so if there's a specific issue that somebody's run across, they can call me. I'm sure the mayor would be willing to have a conversation with them as well, or call Director Butler directly. And if we have bad information, we're happy to correct that.
Thanks, Jason. While you're up, and maybe Yusha would want to address this as well, there's a question specifically about how businesses can sign the pledge and get the window sticker.
Yeah, sure. Thank you. I think Jason has been working, as well as Bob, have been working with Dennis Marstall at our one of our city staff. There, you can go to, I think it's MHK, MHKsafeandopen.org. And they have resources and the sticker that you can get and how to sign on to a pledge. And this applies even to individuals. You know, it's good for all of us to take part in a pledge and make sure we are, you know, going to do everything we can to reduce the spread of the virus in our community. But again, that website is mhksafeandopen.org. And if not, you can email me at ready@cityofmhk.com, and I will definitely get you the information you need. The more people we have on board, the more businesses we have on board, the better. And again, the message just needs to be consistent. I think one of the problems is that when we have 3 counties, Gary, Riley, and Potawatomi, we have 3 different sets of rules. And that's hard for people that are new to Manhattan to navigate. But in the city of Manhattan, this is, you know, if you go to our website or anything, you can find lots of information. The city of Manhattan is doing a lot of things, as many things as we can to flatten the curve, taking all the best practices into consideration. If you're planning on having a wedding, if you're planning on having some kind of a baseball game, a basketball game, whatever it is, using any of our facilities, we have information for all of that. The primary concern is public health. And we want to do everything we can to make sure K-State stays open and that our folks are healthy. Regardless of where they are in our community, we want them to be healthy. And these are some things we can do. But yeah, please go onto our website and take the pledge and get a sticker for your business.
Yusha, you've talked, and I talked earlier about the importance of partnerships across these different entities, these different governmental organizations. We're all one community.
Mm-hmm.
But we do have different approaches to communication. Sometimes we have different regulations. There's a question here about what are the efforts to unite the surrounding communities, create a unified message, and can you say any about that? And is there some place where people could go to see, you know, what sort of efforts are in those areas?
Yeah, I wish there was a place people can go. I think, you know, I feel a little frustrated that every time a governor puts out an order, communities can pick and choose what they want to do with that order, which kind of makes it very difficult for communities if some are doing some things and some communities are not. You know, if you have a seatbelt law, it pertains to everybody. But when it comes to a pandemic, it seems like the rules are different for everybody. So that's frustrating to me as well. And I wish there was a place I can send people to see what each of the communities are doing or not doing. I do know that I try to work hard with all of our community members. And I think, you know, all of them have good intentions. We all want to keep our communities safe. The other piece is we have a lot of rural communities within our each of our counties. So rural communities oftentimes don't have places where they have 1,000 people at one place. So they have different, a different lifestyle, which is not conducive to being in crowds of 20 or 30 or 40 people. So when we say anything like a mask ordinance, it has to be translated to, that is if you cannot maintain a 6 feet of distancing. So if you're in a rural community and you can maintain 6 feet of distancing during your daily work or wherever you're going, it doesn't apply to you, just like it wouldn't apply to you in the city. And I think those are the messages that we are going to continue to work on. These are, there's a lot of myths. There was myths about if it's summertime, you won't get COVID. If you're outdoors, you don't get COVID. If you're eating dinner outside, you don't get COVID. Well, all of that is good if you're following all of these other practices, such as face masks and 6 feet of social distancing and washing your hands. So I think the conversations need to continue. And I think the business sector is probably going to react faster than the other organizations, than the other community is. It's going to fall on the business sector if their employees are getting COVID and then they have to take that 14-day quarantine day off. It impacts some of those small businesses where they just may have 4 or 5 employees. So I think that's going to, I think people are going to start waking up to those types of challenges. And I'm glad we were on the front end of it. And I still feel like we reacted slowly, but we are here now. And we still have a chance for the rest of the counties to join in and make sure we are taking care of public health and understand wearing a face mask when you can't maintain 6 feet of distancing doesn't mean that everybody wears it all the time. It's when it's in certain situations and definitely with certain exceptions. Thank you.
Dr. Tabor, Region Reimagine, which is a program of the Chamber, we post all 3 counties' orders. So anything that those health officials have are posted on that site. And I mentioned Chrissy Rodriguez a minute ago. She's also helping staff the task force, and she's going to take the Manhattan. She already has started talking to some of the regional communities about taking the Manhattan programs, and they can rebrand it and use it for their own community. So she's hoping that some of the work that we're doing in Manhattan potentially could become programming for these regional communities as well.
That's great. Thank you. Bill, you had your hand up. Did you have something that you wanted to add here?
Yes, I just wanted to add, as a faculty member that who does research and teaches, that we have been asked to work with our facilities and custodial staff to make sure that proper distancing is practiced for our lecture classes and the way that those classrooms are reorganized. So for our returning students, I think just to add to the conversation, I would say one of the important things we can do and will be doing is encouraging students to practice safe distancing and set a good example for their classmates and for other members of the community. And that goes a long way. So we're going to do the same thing and make sure that we're, as we're coming in and lecturing, that we're masked when we're supposed to be masked and maintaining distance. If we're holding short office hours in the classroom and so on, that we're helping to sanitize and we're helping our facilities get the classroom ready for the next instructors and things like that, and making sure that students have value for their tuition costs in terms of the classes that need to be in person or use lab space and things like that, but also emphasizing safety and making sure everyone is doing everything they can. And I think that example goes all along.
Yes, absolutely. That actually connects, Bill, to a question that's come in about how we get student buy-in. And the questioner observes that walking about town, you see a lot of young people doing activities and socializing without masks, without social distancing. What can we do to increase buy-in with students? I'll address that to others, but Bill, if you wanted to start us off on that.
So definitely our department heads and our graduate advisors give advice to students when they first arrive on campus. And I think one thing that has to happen is as students return, it's a new year, it's a completely different situation, and students are returning from different places, different cities with different levels of exposure. And one thing that we all have to understand is that we're now bringing all of these students from these different places, from rural to very highly populated urban areas, back together. And so that there is sometimes an amplified exposure. If we're looking at the Aggieville Business District and things like that, it's really especially important to maintain proper distancing and so on, and to remember that we're all one community together, and it's not just for students. There are age differentials in risk groups, and our colleagues are better qualified than I am to talk about that. But in terms of just as with masking, it's not something that we always do for ourselves. It's also for our loved ones and our colleagues and classmates who may be immunocompromised, and that's something to always keep in mind too.
Yes. Would anyone else like to address that question about student buy-in?
Yeah, I will take a chance at this. I was just writing some things down. The messenger matters. So if it's a mom and dad telling their child, their student, this is what you probably should do so that you can keep us and everybody else safe. If you have student athletes saying the same message, if you have musical artists saying the same message, political leaders that they resonate with saying the same message. So the messenger matters. The mayor of Manhattan can say all that she wants, but it's going to fall on deaf ears if you really don't care about who I am and what I'm doing. They don't care. But if somebody that they can relate to, somebody in their 20s, then they will listen to that person. If it's somebody in their sorority, in their fraternity, in their social organization, in their programs, in their economic structure, in their ethnicity. So we need to get all of those messengers on board when we do a full campaign to take these precautions. And I think that's the only way you get adherence to some of these precautions in any demographic. So if we see, the president saying more of this, it might catch on to some of those political organizations as well. And I think that's one of the key factors. But students being what they are, a college experience, maybe, I know I don't want to insult Chuck Tabor or anybody, but 5% is probably on campus, but the other 95% is going to be in the community. They want to socialize, they want to go party, they want to have fun, and they want to make friends and be with them, and that's what they're missing, and that's what they want to come back to. And so we, on behalf of the city, need to take as many precautions as possible, make masks as accessible as possible, have them handy before you go into a business, before you go into a restaurant or anything, just have them accessible. So it's automatic that you're going to put it on or do what you need to do and not make it a difficult process. So I think that also falls on not only the messaging, the accessibility of them, but also making sure that you can have fun and you can take care of public health at the same time. It doesn't have to be one or the other. And we just need to give them all of those options and make sure that we have plenty of options for them to be successful and be truly engaged and be socially engaged and just physically distant at times.
We have about 8 minutes left, so I'd urge anybody who has questions that they really want to ask to get them in quickly. We'll probably only be able to post questions for about another 3 or 4 minutes before we'll need to wrap up. I do want to ask a question that I know I've heard a lot of in here, and this is again for the mayor and for Jason potentially, and this is about bars, clubs, churches, community areas. What sort of restrictions might the city put on those, and how will they protect those businesses? Because of course there's a major economic impact we're talking about as well. So how do you balance those concerns?
So the health officer for Raleigh County is Julie Gibbs, and Julie is the one that evaluates the situation, and she has a lot of different groups that she talks to on a regular basis, and she's the one that will make those determinations. And I think she is working on, I don't know if the new one has come out yet, but I think she's working on updating some rules, particularly as it relates to some businesses, and so I would look for that. But at the end of the day, it's her decision, and then the county commissioners, of course, have some authority in that with their role as the health committee for the county as well. And I probably didn't say that correctly, and Bob can correct me. But yeah, so Julie's role is really important in this, and they are constantly evaluating what's going on, and they have a medical committee, they have an emergency committee, and then they also listen to the task force. So.
Yeah, I'll just chime in on that. Yeah, I think Julie Gibbs, our local health officer, does have quite a bit of leeway in this. But as for the city, I think we have a lot of options as well. I think, the face mask ordinance, we did that as a city. It didn't come from the Riley County Health Department or from Julie Gibbs or from the Riley County Commissioner. So we had to take that upon ourselves. So there are some things as far as home rule, and also with permits, licenses, all of these things that we can look at closer, because when you represent a county such as the Riley County Health Department, and they respond to the Riley County Healthcare, the Board of Healthcare is the Riley County Commissioners. They're looking at the entire county. But if the majority of folks that I have to work with are in my community in the city of Manhattan, then I'm going to do, as well as the city commissioners, are probably going to take as many precautions as possible to make sure our community members are safe as well. And we certainly will work with everybody involved, just like we did the face mask ordinance. And at the end, we had to do it on our own. We will look at all of those parameters, because public health is extremely important. And if we don't take care of public health, we will not have a good business sector. And so that is a huge, it's something that we need to make a top priority. And I don't work as much in the rural communities, so they have different challenges. But in the city of Manhattan, we have different challenges. And I think that's my purview as far as the mayor for the city of Manhattan. And we will look at everything possible to make sure our city is safe.
And there are some advantages when the city will pass the rule, because as you all know, Manhattan is in 2 counties. And so occasionally you could end up with a situation where some businesses are under some rules and some businesses are under other rules. And so there are some situations where having the city take action is better for the business community, because it creates consistency across the entire city.
Yeah, I agree. So thank you very much. It's now time, I think, for me to wrap this up. We're just about out of time. I do want to start just by thanking our panelists. This has really been an incredibly informative panel. I know I've really appreciated the information that you've shared. I know that it's been really helpful to those who've been watching. So Yusha, Bob, Jason, Ellen, Bill, thank you so much for your input here. I really appreciate it. And this is the kind of community action talk that brings us all together to really discuss how we can better solve a fundamental problem that we're all facing. I want to point out to all of you who are listening now that we're putting some resources in the YouTube chat that were referenced in today's panel. Resources from K-State, from the city of Manhattan, Riley County, Region Reimagined that Jason mentioned, the healthcare from the hospital website. Those websites are going to be posted, those links will be posted in the chat, so you can go find more information there. I also, before I run out of time, want to remind you that we're going to revisit this topic 1 week from today. It's July 31st, next Friday. I will moderate again, and we'll have a focus that's more on the community, on the university strategic actions that we've been taking. But again, I want to emphasize in closing, I think what's been a theme across all of this is that although we are, in some sense, divided into small communities, we are one large community, and the virus does not distinguish between those communities. So it's really important that we all work together, that we are all protecting each other, and that we understand this public health crisis, this economic crisis, this political crisis as an opportunity. This is an opportunity for us to come together. And when we do that, we will not only help to solve this crisis by flattening the curve, but we will become an even stronger community. And that will carry forward and strengthen us going forward if we're able to do that. And I believe we are able to do that. I have a lot of confidence in the leadership in our area and in the people in our area. We have, as I think all of you know, we get national recognition for the town-gown relationship between our university and the town of Manhattan, the surrounding counties. This relationship is tight. Let's build on that relationship. Let's become even stronger, work together to solve this problem. So thank you very much. I look forward to talking with you again next week about this issue. And thanks again to the panel.
Thank you.
Bye-bye.